This is an occupational therapist, and she's thinking about transferring a patient. Transfer safety is key to protecting her and her client. Before beginning a transfer, a number of things need to be considered. First, are there any restrictions that may limit the bearing of weight? Second, do they have any surgery precautions related to bending or twisting? Third, do they have any weakness or abnormal tone? If so, where is it and how severe? The OT needs to know these things because they have an impact on how the patient will be safely transferred. This therapist is demonstrating the basic step of preparing for the transfer. She's making sure that the chair is ready by removing the leg rests and one armrest to increase the ease of the transfer, if this is needed. As these items are removed, they are placed safely outside of the transfer area to prevent tripping. This is also a time where the therapist assesses the environment, looking for any environmental hazards, such as wet surfaces. The therapist then positions the chair, making sure it is near the patient, decreasing the distance needed to travel. See how she takes time to set up the chair just right and locks the brakes of the wheelchair when it is in position. The therapist now prepares the client by positioning a gait belt. Some facilities, such as where this therapist is practicing, require the use of gait belts. Others do not consistently use gait belts, with therapists preferring to transfer without a belt. Before placing the gait belt, the OT always considers any surgical scars or tubing that could be affected by the placement of the belt. The belt should be secure around the patient without being overly tight. Any additional length should be secured. This demonstrates an overly loose belt and using it as a means of lifting instead of stabilizing, which is incorrect. Here is another common problem with transfers: rushing. The client is given little instruction and is moved too quickly. This is a safety hazard, and the client or therapist may be unprepared, leading to injury. It is best to avoid hurrying and focus on a safe and therapeutic transfer. This is another example of dangerous transferring. The therapist relying on her own strength to move the client. With proper body mechanics and positioning, it is not needed, nor is it safe to lift the client, straining the therapist's body and creating an opportunity to drop the client. An important basic principle will help create the safest transfers. When it is possible, position the client so they can transfer in a way natural to the body. Observe this pattern of typical standing, moving to the edge of the surface, feet spaced and slightly back from 90 degrees. Lean forward and push off. Knees come forward, weight shifts forward, and then upwards to center, to standing. See how the therapist keeps this in mind while working with the client's feet, first checking them for placement, and then positioning them for movement to the chair. See again, taking time to get it right. The therapist then explains the transfer to the client. She demonstrates pushing off from the surface instead of grabbing the therapist's back or shoulders, which could injure the therapist. She then cues the client to push up and then grab for the chair. After this explanation, the therapist assists with a squat pivot transfer. This time, the therapist transfers a client with hemiplegia. To keep them safe in the transfer, the affected leg is braced by the OT's leg, but the knee is not blocked to allow movement for getting up. The affected arm is cradled to keep it from being injured. She maintains a straight back as she moves the client to the wheelchair. The transfer is not complete without returning to proper seated position. This helps prevent falls and facilitates good posture. Observe here how the therapist realizes she needs help and calls for assistance. Before transferring the client, communication confirms readiness. The assistant keeps the client from falling back and helps facilitate the needed motion. The assistant repositions the client using her shoulder, not pulling her arms. The last transfer is using a transfer board. This is positioned underneath the client, about one cheek in, and bridges with the wheelchair. The therapist reminds the client to refrain from wrapping her fingers around the board to prevent injuring her hand. She also reminds the client to unweight instead of sliding, which can move the board. Always remember, have everything set up and ready before transferring. Take your time to explain and complete the transfer. Watch your own body mechanics to prevent injury. Be aware of the environment to keep footing secure and unobstructed. Be aware of the client's body positioning, especially feet and hands. Ask for assistance. Always ask for help if you need it.